Good morning. We'll start with the fetal skull. We will be talking about the fetal skull. The fetal skull consists of the vault of the skull, the face of the skull, and the base of the skull. In the skull, there are the sutures and there are the fontanels. Now, what are the sutures? The sutures are unossified membrane which are lying between the flat bones. So the sutures are here. This is the frontal suture in between the two frontal bones, the coronal sutures in between the parietal and the frontal bones, the sagittal suture between the two parietal bones, and the lambdoid suture in between the parietal and the occipit. These are the sutures. Now there are the fontanels. Fontanels are also white piece of membrane where the sutures meet. So this is the anterior fontanella and this is the posterior fontanella. Now anterior fontanella is bounded anteriorly by the frontal suture, posteriorly by the sagittal suture, and laterally by the coronal sutures. This is a diamond shaped space which is about 3 by 2 centimeters in size, and this is unossified till 18 months of age, and normally by 18 months this closes. Due to any reason up till 24 months, if this does not close, then it is thought to be pathological. Now, this anterior fontanella is one of the landmarks for knowing the position of the head, for knowing the flexion of the head, and these are used as important landmarks during labor. Now we go to the posterior fontanella, or also it is called as the sinciput. So this is anteriorly there is the sagittal suture and posteriorly there is a lambdoid suture, and this is a raised piece of bone, tabular bone, which is 1.2 by 1.2 centimeters in size. This is ossified at birth. Now, the occipit is also used as an important landmark to denote the position of the vertex. And most of the times in labor, we describe them as sinciput and occipit when we are palpating the head. And then we go to the fact like what are the various diameters of the head. So when we talk of diameters of the head, first we should understand what is the girdle of contact. Girdle of contact means that part of the skull which comes in contact with the fetal pelvis. Now this is the pelvis, and as you all know that this is the inlet of the pelvis. So that part of the fetal head which comes in contact with the inlet, so that is this area all of the fetal skull which is coming in contact with the inlet of the pelvis, they are known as a girdle of contact. And when we are talking of the girdle of contact, we'll be also talking about the various diameters of the fetal skull. So in fetal skull we have got anterior posterior diameters and the other are the transverse diameters. So talking about the intraposterior diameters, first and foremost we go with the suboccipitobradmatic. This is the occipit. So just below the occipit, this is suboccipit region, from suboccipit to center of the bregma. So this diameter, that is from below the occipit to the center of the bregma, this is called as a suboccipit diameter, and this is 9.5 5 centimeters, and when this diameter is a presenting diameter, the head is fully flexed. That is to show you the head is fully flexed, and this is like how you find on a pelvic examination that the head is fully flexed. Then comes the other diameter, that is suboccipito frontal. Here the first point, the posterior one is again the suboccipit, that is below the occipital protuberance and anteriorly the anterior end of the bregma. This diameter is 10 centimeter. Again here the presentation is vertex, but it is not completely flexed. The next diameter is occipito frontal. The occipital frontal is from the occipital protuberance posteriorly and the root of the nose anteriorly. So this is the diameter. So to show you on the pelvis, it will be something like this. This can be seen. This is the bregma. So the anterior end, almost the root of the nose, from occipital protuberance to the root of the nose is this much is the whole diameter, and this will be the part which is the girdle of contact. This diameter is 11.5 centimeter. The presentation is vertex, but this is a deflexed head. Then we go to the other diameters, that is the suboccipito brachmatic. If this is the upper jaw, as you can see, then comes the chin here. So some space here like below the chin. So from below the chin to the center of the bregma, somewhat it may be like this. So the space like center of the bregma to below the nape of the neck, below the chin. So that is suboccipito mentum, and this is a completely deflexed head, and the position will be face. To show you just for understanding, something like the mentum is in the front and the face is presenting. So that is completely deflexed head, and that is face presentation. Then comes the submentovertical. Submentovertical is below the same point, below the mentum, and here on the point center of the sagittal suture. This comes to 11.5 centimeter, and this is like incomplete extension of the head. Then from the mentum to the highest point on the vertex, that comes to 14 centimeter, and the presentation is then called as a bro presentation. Now we'll go to what are the transverse diameters of the skull. The transverse diameter is, one is the biparietal diameter, then there is a supra-subparietal diameter, then there is the bitemporal, and then the bimastoid. So the biparietal diameter, the biparietal is that is from one parietal to the other parietal, the most farthest point. The biparietal diameter is very important because it is only when the biparietal diameter which negotiates the inlet of the pelvis, then we say that the head is engaged. At this point you will note that the bitemporal, the biparietal is 9.5. In a fully flexed head, the suboccipitobrachmatic is 9.5, and a completely extended, the submentobrachmatic is also 9.5. These are all 9.5, but you will always find that when it is a vertex presentation, the delivery is easy, and when it is a face, the delivery is difficult. Why so? The reason is that when it is vertex presentation, there is some amount of molding of these bones and the size reduces partially and the head negotiates to deliver. When it is a face presentation, it is the base of the skull and the face. This cannot overlap and the reduction in the size does not take place, and therefore the labor is difficult. Now the transverse diameters we had spoken, one the biparietal diameter, other is the super subparietal, that is from one parietal eminence to opposite side just below the parietal eminence. This transverse diameter is 8.5 centimeters. Then the bitemporal. Bitemporal is from anterior-inferior end of the coronal suture on one side to the other. This is 8 centimeter. Then comes the bimastoid, the point of the mastoid on both the sides. So that is bimastoid and it is 7.5 centimeter and it is the smallest diameter of the skull. So this was about the girdle of contact and about the various diameters, both intraposterior and the transverse diameters of the skull. Then in labor, there is the fetal skull undergoes molding. So we will be showing you other features of the molding. Now we go to what are the most common presentation and what are their boundaries. One of the most commonly asked question is what is vertex and what are its boundaries. Now vertex is a quadrangular space. Now if you can see in my hand, this is a quadrangular space and here it is bounded. Now this, so bounded anteriorly by bregma and the coronal sutures, posteriorly by the lambdoid and the lambdoid sutures, and laterally the line joining or going through the parietal eminence. So when this part is presenting during labor, then we say that this is a vertex presentation. Then comes the face. When we talk of the face it will be bounded by the root of the neck and the orbit and by the mentum. So they will be the boundaries of the face. When it is a brow presentation, it is bounded by the root of the nose and the supraorbital ridge and above by the sincipit. So when it is a brow presentation, it will be mostly this part which will be felt. This is the picture of the skull showing you all the sutures, the lambda, the occipit bone, the frontal bone. Now this was what we are talking. Now this gives you a whole view. When it is suboccipitobrachmatic, the engaging diameter, this is the head which is fully flexed and this is vertex presentation. And when this is deflexed, you can say this is occipitofrontal. So that is the occipitofrontal and it is a deflexed head. This is a brow presentation from the mentum to the highest point on the vertex and the head is showing brow presentation. This is face presentation and this is the submentobrachmatic diameter which is the presenting part and this will be the flexed, completely deflexed head. A word about caput succedaneum. Caput succedaneum is a localized swelling which is formed on the scalp. This is at the point which is the girdle of contact and there is maximum pressure of the cervical rim. Here the venous return is impeded and therefore there is a swelling. This gradually gets over by 24 to 36 hours of delivery. Molding. Now, what is molding? Molding is the ability of the fetal head to change the shape and to adapt to the maternal pelvis. As you can see over here, that is the parietal bones overlapping each other and the parietal bone sliding on the frontal and the occiput bone. The posterior parietal bone is under great pressure because of the sagittal promontory and passes under anterior bone. Overlapping of the parietal bone also occurs, and this reduces the diameter of the fetal head. Cephala hematoma. Now there is something, the difference between what is a caput succedaneum and cephala hematoma. You can see that cephala hematoma is a collection of the blood, and this is a subperiosteal collection of the blood which is affecting the skull bone, and this is limited by the sutures, whereas the caput is not limited by the sutures. The blood is absorbed by 4 to 12 weeks and caput succedaneum dissolves in 24 to 36 hours. The prognosis is good, but then still the fetus has anemia, jaundice, and these features, they are reduced by giving vitamin K to prevent bleeding in cases of the newborn. If you could understand all that, please subscribe, drop a like, and share. Thank you.